2019 novel coronavirus. If you caught the virus, does it mean that you will definitely die? Is wearing masks really helpful? Are you in the at-risk group of novel coronavirus? Hi, I'm Dr. Lim from Jasper Lodge Nursing Home. I'm the founder and a medical doctor. Today, I'm going to share some information and pro tips about coronavirus. Before talking about the virus, I would like to do a public service announcement. Please watch out for fake news, because fake news is much more scary than the virus. So verify your information before spreading any news. In order to get reliable information, you may visit www.coronatracker.com. This website has information from credible sources, scientists, doctors, and public health officials. And when you get information from the website, you can rest assured that the information is accurate. Will you definitely die if you contract the coronavirus? Not necessarily so. So far, there have been more than 31,000 cases of coronavirus worldwide, and there only have been 600 deaths. More than 1,500 people have actually recovered from coronavirus. So how do you actually die from coronavirus? Most people that die from coronavirus are adults that are above a certain age and have other medical conditions. For example, kidney disease, diabetes, or any condition that compromises the immune system. Because of their low immune system, the coronavirus attacks the lungs and causes this condition called pneumonia, and eventually they have difficulty breathing or other complications, and they will die from the disease. According to the minister, other at-risk group includes people over 60 years old, children under 12 years old, and pregnant women. So here's a pro tip. If you are in an at-risk group, do not visit any hospitals unless it is absolutely necessary, because you have a higher risk of contracting the virus if you visit hospitals. So do not visit hospitals unless it's absolutely necessary. So it is important for us to maintain a good immune system, because not only the coronavirus, our body will be able to withstand any sorts of attacks or infections. So there are a lot of rumors of how we can treat coronavirus. There have been HIV treatment or influenza, antiviral treatment, but these are all not proven treatment yet. These are all isolated cases. It has worked for some, it has not worked for others. So what is being done in the hospital right now for patients with coronavirus? Basically, hospitals provide symptomatic treatment and supportive therapy. That means if this person has difficulty breathing, oxygen will be given to the person. If they have a lot of phlegm, suction will be done, and if the patient is dehydrated, we will give this patient drip or intravenous fluid. So some people ask, is antibiotics helpful in treating coronavirus? Antibiotics generally do not treat virus, it treats only bacteria. So coronavirus is not afraid of antibiotics. In fact, most cough and cold, whether it's coronavirus, common cold, or influenza, are caused by virus. So antibiotics are usually not helpful in all these cases. But during this episode of infection, your body's immune system may be lowered, and some naughty bacteria will take the opportunity to infect you. If that's the case, the antibiotics will be prescribed to treat the bacterial infection. Some people are worried about their children getting infected with coronavirus, but to date, surprisingly, children have been doing extremely well against the virus. The immune system seems to be able to resist the virus attack. Final pro tip, is wearing a mask really helpful? First things first, let's wear masks in the correct way. The metal part must be on the nasal bridge. The white part, or the one with the folds facing upwards, must be facing your face, must be inside. And the coloured part usually must be facing outside. This is the only and the correct way to wear a mask. So if you're not sick, do you really need to wear a mask? If you are sick, especially having flu-like symptoms like coughing, running nose, sore throat, you definitely should wear a mask, because you should protect the people around you by not infecting them with your virus. Coronavirus is spread via droplets. So if you touch a surface that is contaminated with coronavirus, and if you touch your face, the virus may enter your system through your eyes, your nose, or your mouth and cause an infection. So it's much more important for us to keep our hands clean, wash our hands often, and avoid touching our faces rather than wearing a mask. But if you are sick, please wear a mask so that you don't infect other people. So in conclusion, if you are an at-risk group, try to avoid going to hospital, try to avoid traveling as much as possible, wash your hands, and make sure that you avoid touching your face. That way, you may be able to protect yourself from coronavirus infection. If you have any questions, please leave your questions in the comments below, and I'll answer all your questions.